Hi, my name is Leandra Holmes, and this is my final project for CHPM 2605. First, we're going to start with my binders. This is my research binder. I have tabs in it for vertebral subluxation, where I have an article called Postural Rehabilitation for Adolescent Idiopathic Scoliosis During Birth. I have wellness and development care, the use of spinal manipulative therapy for pediatric health conditions. I have a tab for subluxation condition-based care. I have a tab for chiropractic spine. I have a tab for functional neurology and chiropractic. Current mechanic systems, bad medicine, other vitalistic systems, and other areas of interest. My second binder is my binder for my practice management files. It has tabs for the pre-visit, visit 1, the healthcare class, ROF, progressive exam, and any extra things I want to add. Okay, now I'm going to start my initial visit with my patient. Okay. Hello.
Hello.
Nice to meet you, Brianna. I'm Dr. Holmes, and I'm so glad that you could come into our office to get your health on track. I was told that you had complaints about neck problems when booking this initial visit. For this, I'll be performing a case history with you, along with a patient examination to fully understand and diagnose your neck problem. I will also be preparing a specialized chiropractic examination to better understand how your body is functioning on a more widespread level, especially seeing how any neck issues may interfere with how your body is functioning. This exam will include x-rays to help get an understanding of what we can't see or feel on the outside. Now, can you tell me when this pain first started to bother you?
About a month ago, I was up late studying for a test and fell asleep in an awkward position on the couch.
Okay, is there anything that makes this pain better or worse?
Any physical activity, such as turning my head side to side, aggravates it, and resting makes it better.
On a scale of 1 to 10, what level is your pain, and can you describe it in your own words?
The pain is about 5, and it's deep pain that hurts the whole back side of my neck.
Does the pain radiate or travel elsewhere in your body?
No, it's just the back of my neck.
Okay, can you show me exactly where it hurts?
Yes. Right here.
Okay. Thank you. And lastly, is it less or more painful at any specific time?
No, the pain is the same all the time.
Okay. Now we'll do the patient examination and chiropractic exam, along with take some x-rays. Okay, so now my patient will do the exams and finish everything up, and when she comes back later on that day, this is what we'll talk about. Okay. Now that the exams are done, we can go over what I found about your health, called the report of findings. But before this, I would like to explain the 3 different care types so that you can understand the goal of my office as it pertains to your overall health. Firstly, we have condition-based care, which is the reason you're here today. The goal is to relieve you of any symptoms you're having, but not for total correction of the problem. Next, we have corrective care. This is to fix the problem, not just the symptoms. That, in your case, is the pain in the back of your neck right here. This is to ensure that the pain doesn't come back by fixing the problem that started the pain. Lastly, we have wellness and development. The goal here is to make sure that your body maintains a healthy state. That is preventative care plan or mindset to ensure that the same problem producing the type of symptoms doesn't happen again. So this is very important because we need to maintain your overall health and prevent future injuries from occurring. You can think about these stages of care as we talk about your report of findings and what can help you in your situation. Okay. To start with, we have an initial complaint, which is the neck region. After performing a case history, I saw that it started about a month ago and is becoming very uncomfortable for you when you're trying to perform any physical activities that require you to move your neck, which is pretty much any activity that you do any day, so that must be tough. Okay. From the physical examination, we saw that you had the inability to perform ranges of motion. That's pretty much moving your head in different directions without discomfort or sometimes pain. Neurologic or orthopedic tests also confirmed that there was a problem in the neck region, so they had just already confirmed what we thought was suspicious. Next, we performed the specific chiropractic examination by assessing for vertebral subluxation complexes. A spinal kinesiopathology exam was performed to test your range and limitations of motions, which we just discussed. As we see, your problem there is on the right side, and they're causing you to experience decreased ranges of motion, which can be corrected by removing the interference. So under chiropractic care, we can definitely help with that problem. With the neuropathology exam, we have a graph here. It's back there, and that is showing showing the abnormal changes in your nerve function that we can see in your neck. These are caused by subluxations, limiting how the nervous system expresses itself to your body and causing the pain you're feeling. Okay. Next, we performed the myopathology exam. As I'm sure you know, we found tightness and stiffness in the problem of your neck, which would be, again, on the right side. The misalignment of your vertebrae is attached to many muscles. And when the vertebrae are misaligned, it causes tightness and pain. So any of the muscles that are attached to the vertebrae, if it happens to move, then those muscles pretty much are stretched out to their maximum capacity, and they don't have much wiggle room there. Here we can see the results of the histopathology exam here. You're coming in at a young age, which is very good because right now we're not seeing any disc generation that may occur, which could be bad if prolonged and not taken care of. However, if the subluxation were to be left untreated without correcting it, disc generation can be seen in these 3 stages, as I showed you before in the hallway, that are compressed by misalignment causing the subluxation. So basically, if you have a subluxation, your vertebrae can compress down, and any other space that's in between them is smushed. Okay. This is where our preventative care comes in to ensure that disc degeneration does not occur. So if we can prevent it from occurring, then that's a great thing. Lastly, we took x-rays to assess for pathophysiology in the form of spinal degeneration. Again, you're coming in pretty young, so we don't see any phase of degeneration, which is, again, great. If your subluxation was left, however, we could see degeneration of your cervical spine as the curve changed from its optimal point. It is a better option to prevent spine degeneration by removing subluxations rather than trying to go back to normal after degeneration has taken place. And this is again where chiropractic care corrects and maintains your overall health. I'd like to ask you now if you have any questions or concerns with anything we have gone over, or would you like me to explain anything over or more like in detail for you?
No questions about anything we have discussed, but I was wondering how long it will take to fix my problem.
That's a great question. I recommend, currently right now, after looking over all your findings, I recommend that you come in 3 times a week for the first 5 weeks so that we can get you back to normal and functioning without pain as soon as possible so you can move your neck all around. After that, we can reassess your health and improvements that are made over that time and reduce the visits to once a week for 6 weeks if you're not having any problems maintaining your health goals that we set. I have office hours for new patients on Monday from 10 to 3, Wednesdays from 9 to 12, and Fridays from 10 to 3. I also have a mandatory new patient health care class on Tuesday from 6:30 to 8:30 where we serve light refreshments, and you can ask my office staff any questions that you have. So pretty much you come in for the healthcare class and you sit down, and there's a is it still recording? Well, it should be. I can just cut this space out though, can't I? It should be. Oh. Yeah, it's still on. Okay. I'm gonna crop it out. Okay. Yeah, but basically the healthcare class is you come in and you sit down and you get refreshments if you like, and we play a short video for you to watch, and then either I or one of my office staff comes out and they speak to you all about chiropractic care, and they tells you more of the in and outs, specifically how we help health, and that should help you understand any questions that you or maybe not understanding or not very sure about. That class will hopefully clear it up. And then again, if you have any questions, then you would ask us at that time. But after the session today, you may attend the healthcare class again as many times as you want. We would love for you to bring any family or friends. You could also bring them to an appointment with you to get them involved or in a more healthy lifestyle through chiropractic. I know you don't have any kids currently, but anyone that you know who has kids, our work is very good for kids because they're always moving and moving around and trying to try new sports and falling and having a lot of different stuff going on. So maybe you could bring one of them to one of your appointments or the healthcare class and try and get them in the office and get them under care also.
Okay, that's awesome.
Okay, now I'd like to briefly explain our attendance policy to you. If there are any emergencies that make it unable for you to attend an appointment, we just want you to let us know 24 hours in advance. In the case of an unforeseen emergency, please give us a courtesy call at your earliest convenience to let us know that you can't make it, because sometimes 24 hours is a bit way off if it's short notice. We understand emergencies happen, and we only want you to let us know if you can't make it. There are no consequences if you call and let us know. However, if it becomes a routine and you don't call and let us know, and after 3 occasions, we'll have a cancellation fee of $30.
Okay, I understand. I plan on making all of my appointments.
Okay. Now that I know that my office staff earlier informed you about this is a cash only practice. Mm-hmm. So let me just make sure you understand. At this practice, we accept cash, debit, and credit card payments. We will not accept personal checks or insurances. Mm-hmm. If you wish to file a claim with your insurance, then we can provide you with any information you need to make that claim. However, we will not be processing any insurance claims for you. This must be done privately between you and your insurance company. For payment, an adjustment appointment will be $35. Your physical is $75, and that includes your x-rays. But the $35 is for a single adjustment appointment. There are also 2 payment plan options that we have. Involving 10 appointments at the price of $275. That's the first plan, which breaks down to $27.50 per visit. So that's a bit of a save. And then there's also a second payments plan, which is 20 appointments for the price of $560, which breaks it down to $28. So that's also a few dollars off each time. The first plan will save you $15, whereas the second plan will save you $40 in the long run. These payment plans must be paid in advance if you choose to do them before we can render any services. Now that I have explained everything, I will give you this patient agreement plan covering everything we just discussed. After you read over everything, if you agree, please sign and date at the bottom here. So I'll give you a few minutes to read over that. Okay, 3 minutes later. Wonderful. Now I'll walk you to the front desk. You can schedule an appointment with my office manager, Ashley. We want to just thank you so much for coming in today, and I'm excited to get you back to your optimum health.
Thank you.
Thank you.